All right, let's jump right in. Today, we're going to unpack the story behind Rainbow Children's Medicare. This isn't just about a company that's getting bigger, it's about one that's growing with a very clear mission. We're going to dive into their latest annual report to see exactly how they're changing the game for healthcare in India.
You see quotes like this all the time, but this one from the chairman, it really sets the tone for everything. It's telling us that for Rainbow, providing top-notch medical care isn't just a goal, it's their entire identity. It's their North Star. Let's keep that in mind as we go.
Okay, so with a mission that big, you've got to ask, just how big is this company? Who exactly is Rainbow Children's Medicare?
And wow, the numbers are pretty staggering. We're talking about a huge network. 19 hospitals, 5 clinics, and almost 2,000 beds. They've got 2 main brands you'll see, Rainbow Children's Hospital and Birthright by Rainbow. But here's the really important part. Those accreditations, JCI and NABH, think of them as the Michelin stars of healthcare. They're a sign of an intense commitment to quality and patient safety.
Now, a network that large doesn't just pop up out of nowhere. It's built on a very specific, very smart blueprint. So let's pull back the curtain and see how they're doing it.
At the very heart of their strategy is this brilliant idea called the hub and spoke model. It's pretty much what it sounds like. Imagine a giant wheel. Right in the middle, you have the hub. That's the big, advanced hospital. Then, reaching out from the center, you have the spokes, smaller facilities serving local communities.
And here you can see how they work together but have different jobs. The hub hospitals, they're like the major league players right in the city center, built to handle the most serious, complex cases. The spoke hospitals are the local heroes, set up in growing neighborhoods to provide easy, convenient access for more everyday needs. It's all one team, just playing different positions. And the genius of this model is how it all connects. You get this amazing synergy where a patient can easily be moved from a spoke to a hub if they need more specialized care. It's also super cost efficient. They can reach more people without having to build a massive hospital in every single town. And maybe most important of all, it allows them to keep quality high everywhere. They can grow, but grow the right way. And they're not just expanding their map, they're expanding what they can do. They've ramped up their fertility services to 12 centers, opened a new child development center, and, get this, they even performed their first liver transplant. That is incredibly complex work. They've even launched their own line of pediatrician-approved products. They're building a whole ecosystem of care. Okay, a great mission is one thing, a brilliant strategy is another, but does the math add up? Let's take a peek at the financials. Just look at that. That upward curve tells you pretty much everything you need to know. The purpose-driven strategy we've been talking about? Well, it's paying off. Big time. Let's put a number on that growth. Almost 17% revenue growth year over year. That's huge. It tells you that their services are in demand and that their expansion plan is working exactly as it should.
But honestly, this next number is the one that really shows the strength of their model. A 32.3% EBITDA margin. In plain English, that means they are remarkably profitable and efficient. This isn't just growth for the sake of growth. This is smart, healthy, and sustainable.
And here is the kicker. Because they're so financially healthy, they can pay for all their future expansion, new hospitals, new technology, all by themselves, using their own profits. No big loans, no outside debt. That is a massive vote of confidence in their own future. But like we said from the very beginning, this isn't just a story about money, it's about purpose. So let's shift gears and look at the impact they're having beyond the balance sheet. So check this out. Through things like solar power, they cut their carbon emissions by over 7,600 metric tons. That's a serious commitment to making sure the planet is as healthy as their patients. And in the world of healthcare, you absolutely cannot mess around with bio-waste. It's a matter of public safety. So seeing them properly and safely dispose of nearly 340 metric tons, that's a huge deal, and it shows they're protecting the entire community. But their impact gets even more personal. I mean, look at this. They ran a drive that added 56 new potential lifesavers to the National Stem Cell Registry. And then, somewhere else entirely, they installed a water purification plant, giving almost 2,000 people access to clean, safe drinking water. That's not just corporate responsibility, that's changing lives. All right, so you've got a brilliant strategy, rock-solid financials, and a real heart for the community. The question is, what's next on the horizon for Rainbow? And that really brings us to the big question, doesn't it?
As they keep building this incredible network of care, how will they shape the future of healthcare for millions of children and families across India? They've built the model for responsible, high-quality growth. Now we get to see how that purpose continues to shape a healthier future. Thanks so much for joining me for this deep dive.